Welcome, everybody. Thank you so much for coming. I truly appreciate it. My name is Lynn Doran. I'm a principal of Global Finance Strategies, and we are thrilled to be hosting this event with our partners DevEx and Inside NGO. I think we're going to have a great discussion on localization. And the important point here is that it's going to be from what I call the untold story. The untold story is from the operational side. All of the administrative, financial, compliance, regulatory types of things that one must need to do to be able to implement effective development aid. So for me, it's an important angle. It's how I've spent my last 30 years, and that'll be the tone of the conversation. So let me first introduce my panelists. We have Carlos Carazana, from the Executive Vice President and Chief Operating Officer from Save the Children. Karen Sachinga, Executive Director of the Churches Health Association of Zambia. Ariel Pablos Mendez, the Assistant Administrator of USAID. And Elizabeth Warfield, the Local Solutions Coordinator at USAID. I want to thank Raj Kumar, who, as everybody knows, I'm sure in this room, is the President and Editor-in-Chief of DevEx. He's going to be our moderator. He's a social entrepreneur, digital media executive, and it's just a pleasure to have him here. Tom Dente, who's sitting over there, is the Chief Operating Officer of Inside NGO, another one of the partners of this conference. It's a membership organization, I'm sure that many of you know as well, 300 international NGOs, and he's going to give us opening and closing remarks. And he'll also escort us to the cocktail party, which is after this, which is a very good role. So Tom, without further ado, I turn it over to you.
Okay, good afternoon, everyone. Thank you for coming. My name is Lynn says, Tom Benham, COO of Inside NGO. Inside NGO, if you don't know us, we're a membership association of 325 primarily international NGOs, but also professional services firms and foundations and local NGOs as well. For more than 35 years, we've been working to support our members as they focus on organizational effectiveness through capacity development, expert advocacy, expert convenience as well. So we're delighted to be here today to host this very important event. In many ways, this is not a new topic. Localization has been part of many of our strategies and approaches for several years. But what is new is both the pace of change and the acceleration of that change. And I think that will be interesting to talk about more today. We're delighted to be here for not only the dialogue around localization, but just also to think about what some of the new solutions. Recently, Inside NGO, we completed a survey of our members, and we asked them a number of different questions, and localization came up in two different areas. First, we asked our members to assess the range of issues that their organizations almost 79% that building the capacity of local NGOs is one of their top concerns, and with 52% stating that it's their biggest concern as they look ahead. And this importance was uniform across organizations of different sizes, across multiple different management levels and locations around the world. Secondly, we asked our members about a range of upcoming needs, including the need for local capacity development services. Not surprisingly, 65% indicated they would use or almost certainly use local capacity services to support their partners and their work. And again, this finding was consistent across organizations of different sizes and levels of management, but it became more of a priority as you move from the center to regional and local offices. And then finally, we recently asked in January chief operating officers of international NGOs what trends will most shape their organizations in the future. And along with the top three trends, including funding pressures and delivering impact, localization was their top three priority. So overall, our members support local accountability to both sustain results and better adapt to changing local conditions. When questions do arise, though, they tend to be around issues of mutual readiness and shifting roles given the pace of change. Here they're asking, where and how can we partner with local organizations to take on, so they can take on expanded responsibilities? And they also ask, are we ready as international NGOs to shift our roles and to shift our activities to to better support local NGOs in developing and their capacity and delivering results? So in the end, what do we take away? First, localization remains prominently on our collective agenda. And secondly, as we look ahead, organizations and leaders are looking for new solutions and new opportunities and new ideas to partner on local capacity development. We're excited in this time of change. We believe that funders, international NGOs, local national NGOs increasingly will look for mutual ways to support and sustain local accountability and results. So on behalf of our members, I want to thank Global Finance Strategies and DevEx for sponsoring this session, and we look forward to an informative and productive debate today. Thank you.
Thank you, Tom. Thank you, Tom. I think it's an interesting day to have this. I assume all of you follow us on Twitter, and you saw the big news that there is a new nominee for the aid administrator job. I know at least these two folks sitting next to me have seen that news. Gail Smith is the president's new nominee. And in fact, I hope we're videoing this, because this could be like part of her training for her confirmation hearing, I think. Because if there is an issue that is going to get attention, it's this one. Localization is the kind of issue that everybody sort of agrees with in development, but the how, as Tom mentioned, the how do you actually do this, not everybody agrees with. And it's been an interesting few years of debate around what do we mean by localization. If we get one thing out of this discussion today, I hope it's that we have a sense of what does local actually mean? What does that term mean, and how do we understand it in a development context? I mean, in some ways, localization is really just development. It's like a synonym for development, because in the end, it's about doing development work on the ground, the people in their own country doing their own work. But getting there is really, really hard. I had a chance to write an article about this for DevEx a few years ago, and I entitled it, How Local Can You Get? And I tried to find out who's trying to get as local as possible, and actually visited a couple of village projects in Western Kenya. And I remember having a meeting with a local government official. His title was assistant chief, and he worked out of a small room, probably as big as this little stage. And he had in the corner a pile of bags filled with grain. And he was pretty eloquent and pretty aware, based on his work with the NGOs that he had been partnering with, on what some of the key development issues were and how his government and his organization had to address them. And then I noticed on the back of his chair, he had a pair of handcuffs slung over the chair. And I said, what are those for? Well, among his many duties was to wrestle drunks to the ground and tie them up for lots of problems, from the big policy-oriented ones we can discuss in rooms like this to what really goes on the ground. And so, Lynn, you put together a fantastic panel that I think is going to help us get into these topics in depth. And I want to start off, because this is not new, as was mentioned by Tom. We've had an administration that's focused a lot on localization. We've got Liz Warfield here. Liz, this is your role at USAID. So I thought maybe you could kick us off by giving us a sense, when you hear localization, what does it mean? What should we think of when we hear this term?
Well, I think, first of all, I'd like to commend you for your report, because I think it really captures the why and how the market for development assistance is changing and being measured due to the leadership of the developing countries, the role of the BRICS and other emerging economies, and new forces and players. And we believe that the report captures a lot of the issues related to localization and to organizational development issues. We did not view localized aid as an end unto itself, but rather as a sign of a broader shift to country ownership or local ownership and sustainability. And so our direct partnering with local actors and local systems, which is referred to as local solutions, reflects USAID's commitment to creating the conditions whereby countries can own resources and sustain their own development. And last April, we issued this report that's readily available on the internet. After consulting with 400 people internally and externally to USAID. It's called Local Systems, a Framework for Sustained Development, which reaffirmed our commitment to sustainability and country ownership. And the important thing about this paper is we recognize that achieving and sustaining any development outcome depends on the contribution of multiple and interconnected actors. So building the capacity of a single actor or strengthening a single relationship is insufficient. Rather, the focus, it needs to be on increasing the performance of the system as a whole, the actors, the interrelationships, and the incentives that guide them. With the health of the system as the lens, then the focus shifts from the sustainability of an organization to the sustainability of the results. And as the report confirms, there's a role for everyone, including our implementing partners, our staff, to play in this new paradigm. It's just a different role. Less of service delivery and more as conveners, facilitators, brokers, and impact capacity developers, and impact investors in a broader system. So to close, where sustainability is the ultimate objective, USAID is committed to deploying all of our development resources to use, strengthen as needed, and partner with local systems.
Yeah, I think there's a key distinction if you look at that report, which I recommend to you to read if you haven't, the local systems report from USAID, and you look at this report. One of the key distinctions is this report is focused a lot on really the local NGO piece.
Yes.
What does it mean to partner with that local NGO? Whereas the USAID lens is much more about systems and in fact a lot about the government role, the country ownership, which is a big piece of I think the shift we're now in, which is that the idea since the Busan conference and even before that, that countries need to own their own development. They have to have a stake in their own development. But I want to just take off of what Liz is saying and move to you, Carlos, to ask you, as a chief operating officer and executive vice president of one of the biggest international NGOs, Save the Children, has this move to local solutions meant changes for your organization? Liz mentioned the idea that maybe big NGOs will go from a bigger focus on solution delivery to more about local capacity building and facilitating and brokering the relationships on the ground. Is that happening in your experience? Where do you see this going?
It is. In the case of Save the Children, we did start to localize a long time ago. It's part of our DNA. Our colleagues in the advocacy team, one of my colleagues is with us today, Jenny Russell. We've been pushing for local ownership for almost a decade. So when this move by the donors, different USAID came on board, it was just very easy to integrate. Clearly for us, if we're working with a local NGO, and hopefully it's a member of the Save the Children family, we're able to advocate better, we're better able to have stronger partnerships with the local governments, we're able to influence the government. So for us, it's key. Clearly, there's a compromise, there's a trade-off. It's the bottom line. The funding will not flow through you, and that's something that we have had to reconcile as a federation of 30 members working in 120 countries. USAID might be funding our work in the Philippines directly or DFID in South Africa directly. What role we will play, we will negotiate that. And it's very context specific, and I've seen all kinds of iterations on how we can partner. But yeah, it's pushing us to move even further. We're trying now to localize some of our country offices, especially those in middle-income countries. Because for Save the Children, the ability to be self-sufficient, to fundraise, to bring income on your own in the country is key. So can we localize Guinea, Liberia? Not yet. But definitely the middle-income countries where we're operating as a country office, I think as a federation, we're ready to let them go. Tell me to stop.
It's fascinating. I was going to ask you the follow-up. So that is the distinction, because I've heard this question before from international NGOs. What counts as local? Because many have local affiliates, local offices. So in your mind, the distinction is, can it be self-sustaining on its own? Can it
completely
raise its own money? Yep. Local staff?
Local staff, local governance, locally led, and the ability to raise funds locally from individuals. So it's a lot of efforts in fundraising, mass market, direct mail, a lot of efforts on with corporates, with foundations, and with local governments too. So that's kind of like the test. Can Thailand become a member? Well, can they fundraise locally? And that's how we differ, who will be a member and who would not. And then there's a huge investment from the Federation to create those members. It's around $1 million a year that we put in to create fundraising systems, to help them with advocacy, to strengthen the program quality. And these are the other members investing in this pot of funds. So clearly we cannot convert all of them, but we're moving in that direction.
Karen, you're here with us from Zambia. And before I ask about your organization, your experience, you run one of the biggest NGOs in the country, one of the largest local NGOs in the world. I wonder, are you seeing what Carlos is talking about among other local NGOs in Zambia? Do you see more funds flowing to them directly, more autonomy, self-sustainability among other NGOs?
I think I want to say thank you very much for inviting me to come from Zambia and perhaps speak on behalf of the local. I don't know how I can define local, but indigenous and organic local. I think the definition of localization is very subjective. I can't help listening to the definitions as you speak, and in my mind I'm saying, so what is local? Does local mean Egg Path, for example, or Save the Children having a headquarters in Washington and having a branch in Zambia, and then that office in Zambia, you're calling it local? As local organization and indigenous organization, organic, homegrown, we do not consider that as local at all. And I want to be
Neither do we.
I want to be very honest here. We do not consider that as local.
Yeah.
Because you have just an office in Lusaka or in Harare or in Kenya. It's part of your office. And what we see, we do not necessarily see money flowing to the local. We see money going to your branch in Nairobi, your branch in Harare, and in Lusaka, and you call it local. We don't think that that is local. Because you have established offices in those countries and you're calling local. And there are local organizations where we think that you should be building capacity. Those that are already existing, you can build capacity, those that are just establishing, because they are local. Now, what we see is that even though you have offices in these, most of them are capital cities anyway, and some of our big cities, what we see is that the umbilical cord, if you like, is not yet cut from the headquarters in Washington or New York. It's not cut. They're still listening. They're still getting directive from yourselves. For example, when we work with the middleman, okay, Save the Children in Lusaka, is a middleman. Middleman because the donor is here. Maybe the donor is USAID or some other donors. That organization is a middleman. Now, when we go into partnership with the middlemen, and sometimes they are made to make decisions on program implementation, what we see later on, and usually when those programs are being audited, is that there's a goalpost change. So the middleman who have said, yes, do this and do this and this, it's okay. But when the chips are down, when audit has to be done, they will not own up to those decisions, because the headquarters from yourselves will be saying, no, this shouldn't have been done.
The COO.
Yeah. So I think when we say local, we need to be very careful in our definitions.
But do you see any change in this at all? I mean, Save the Children and others have been working in this way you're describing for decades and decades. Are they becoming more local, or is it impossible to ever get there? Are they getting out of the capital cities? Do you see?
No, I think we're seeing
change.
In fairness, we are seeing changes.
You are.
But I think the change is taking too long, because we continuously hear that we don't have capacities. And I want to say, and I want to speak on behalf of those local organizations from where I come from or from the South, that when we continuously hear that we don't have capacity, in all honesty, we feel insulted, because it is subjective. It is very subjective. We want our donors and we want our partners to believe that there's some inherent capacity in the local organizations. That all we need is facilitation. And facilitation may be through technical assistance. And we don't want the international organization to go today. No. We still need our capacities to be built, because we don't have all the capacities. So, but we have some inherent capacity in us, among us, down south, that enough capacity to implement. What we need is funding, perhaps more funding or less funding, depending on what it is, and also technical assistance. So to actually generalize that we don't have the capacity, to be honest with you, we do not take it kindly, because we do have some capacities.
Sure. But is this issue of indigenous and organic, because you said that a couple of times, does that matter in the end? So if we're 10 years from now, and the reality, I mentioned earlier that there's a new perch at USAID, whether an organization is indigenous and organic, does that really matter at the end? Or what matters to you at the end, I think as Liz was talking about, is, this is all about development. In the end, we're trying to get to a development result. Does this debate influence that result, or is it kind of a sideshow to the ultimate goal?
Well, for us, that's part of what development is. I mean, we clearly aspire to see a country, like President Kennedy said when we got going in USAID 50 years ago, is for those countries to walk on. That's very important. It's intrinsic. But the world is changing faster now, and I guess that's why the conversation. We have two things coinciding. One is the plateauing of the international development funding, and on the other thing also as complementary to those changes in countries. And you have mentioned financial engineering. I like that. It's not only the innovative part, there's also big macro engineering on financing on every child, which is looking at that growth in the future. How can we borrow from that future growth to address dying mothers and dying kids today? So international development assistance loans from the bank, great way for those countries to commit. Also want high-level quality of the technical assistance and the requirements and so on. That's good, and it can be done also locally and more so. But to the extent some resources could go directly to local recipients, as Karen puts it, and you lives, and we all are part of that. But no doubt, this issue, transition sustainability, is happening before our eyes. Capacity is growing before our eyes. And I think what this report does is to point out that among some NGOs, some assistance in what is more the administrative, the backroom things, as opposed to the front room activities, which we all believe you can do and you have been doing. But for some of them, the backroom things, even for me, is a lot of paperwork when it comes to applications with the USG. And some of you have mastered that over decades, but some new NGOs locally haven't. And I think providing guidance and support for that is certainly a good idea.
And I think what Lynn has done in this report is to divide out exactly what you're saying, the types of capacity to do the work, and capacity to understand how to manage regulations, reporting, proposal processes. And not only are you kind of have a message for everyone,
Sure.
Right? There's a message for the donors, make your process simpler. There's a message for the local NGOs, learn how to do this. This matters. So I partner in a new dynamic. I wonder, Carlos, if we've gotten into this debate a little bit, and it's an interesting one from my perspective, because especially when you go to visit some of these countries and visit offices like yours, you may see now, versus 20 years ago, the team is all local people. Are you seeing any of that?
Yeah, in theory, yes. And I think the local NGOs, for the most part, provide even better quality of services than the international NGOs, because they're so close to the beneficiary. They really know their stuff.
Which suggests not a lot of value added and being an entity that can actually add value. I wonder, Karen, do you see that dynamic being possible? Or in your view, should the real issue be, to our colleagues here at USAID, that they should be more directly funding the local? And
I think for the organization that I work for, it's already happening. We had the PEPFAR funding since PEPFAR began, and we're working with CRS. CRS was...
Say, for Karen's sake, we're doing a lot of local. The numbers will come out soon. And I think I also would say the systems that you referred to early, country ownership, that's not all about government. And I think, two incubators, accelerators, that's where you're going to see impact on the results there. So that's what, I like to say, going from retail to wholesale to make it manageable both for our staff and also for our international. To partner with aid, understanding the types of USAID awards, effectively responding to our award solicitations, preparing budgets for assistance applications, and the PVO registration for US PVOs. And we have those modules in English, and we're translating some of those now, and it's on the public website. So how to work with USAID to make it, as we heard in the report, simplifying and streamlining. The other piece of new information is that with the OMB Super Circular, for those that actually track it, which became effective on December 26, 2014. There's some important points in there, especially, you can see it in our ADS, whatever it is, 303. June will help me on that one. But in there's some favorable developments for local organizations, including these changes include 2 CFR Part 214, which allows non-federal entities with negotiated indirect cost rates to elect to charge a de facto annual threshold of $500,000 has been removed, and organizations may receive fixed amount awards not to exceed $1.5 million over 3 years. And so this is also a new development. But really, on the donor harmonization, I think the information sharing and working with local partners in non-permissive environments.
Yeah, if we could even get USAID and DFID to have harmonized local processes, that would be a huge step. You think it's possible?
It should be a big step.
They've been trying. But can I?
Yeah, because we never get a chance to see USAID. They have on their website call for proposals, and somebody they're here. So you have to work through an international NGOs who knows how USAID works.
And I don't think that's going to change necessarily. If I understood right, part of what you were saying, Liz, is that the reality is USAID is not going to become triple its current size and staff. So you're not going to have the capacity, the contracting officers on the ground to get to know every local NGO. You're going to have to work with these apex institutions. You're going to have to go wholesale, if I understood correctly your analogy, right? Go into the systems that exist, the big institutions like a CHAZ, which is one of the biggest health institutions in Zambia, and work through them to connect with others. Am I understanding the systems methodology right?
Once again, at the end game is sustainability and country ownership. So whatever gets you there, and keeping that in the whole conversation. So what is the best configuration of that? Whether that's working directly with the government, whether that's engaging the private sector, whether that's policy dialogue with the government, whether that's direct funding to a local entity, whether it's a public-private staffing front. And there are 3 things as we move from a metric-based to a practice-based approach. Number 1 is revising our guidance, and what you don't hear enough about is the project design and the broader systems design. So really cultivating that whole program cycle thinking, revising that with the expectation that'll be done hopefully this fiscal year. We're training up staff, not just in the very important organizational capacity parts of the financial management, the procurement, but also but they're 130 pages. So I read them and making sure that, and I checked how many times sustainability was actually there, and we're working on that. And building into our incentive scheme from our core competencies and how we recruit to how we assess performance. As a Foreign Service officer, the Foreign Service skills matrix, building a sustainability, country ownership there, and then how we promote on that. So really building that in. So a practice-based approach based on guidance, training, and incentives. Does that mean there's going to be more staff out there? Maybe a little bit, but still trying to manage this all in a way that in the end keeps the lens on the sustainability, but also makes it manageable for us, our local partners, and the internationals.
And this is, I think, Ariel, when you look at trying to hit the sustainable development goals, you're looking at health indicators, country-wide. This is basically what you're doing, right? You're looking at each country and saying, what's the state of their health system? What's the capacity of the government? Who are the local NGOs? And then designing your programs against that. Is that sort of the methodology that you would use?
That's right. No, I think that, of course, money is very important, but it's not the only asset that we deploy, right? It's sometimes the ideas themselves are powerful, the convening is powerful, the diplomacy is powerful, the listening is powerful. So all of those things are into play to align ourselves in, but it also increasingly is, of course, all along the local governments, the local societies are paramount, and more of that. There is a lot of the ODA being diluted means increasingly is going to be local in every way. So making sure that we're all aligned in this. In the case of health, because in the end it's not automatic that if economic development allows countries to invest more in social sectors, it's not automatic that they will, right? So we need everybody to be behind the same purpose. And in the end, all of this is for that purpose, right? We want to have people to have a better life, to have a fair life, a fair chance in life. And working towards that for us is very important. So everything we do globally, that is from global guidance to global convenience to SDGs to GFFs, is important to support countries moving in this direction. But we are very optimistic. And in a way, success is great, but it's painful too, right? For USAID, we have had so much success in international development around the world, Latin America. We used to invest in South Korea. I mean, they are now great nations in terms of economic capabilities and partnerships. It also means that we had to graduate programs. Right. And as a community was incredible because we've been in a 20-year of the sort of a golden era period, both in terms of the relationship to that space in the world and the resources globally. But 20 years down the road, 30 years down the road, we will still have needs for international assistance, but it's going to be a much different world. That's why I say also in terms of our partners here, those who are in the international space, as opposed to the local, is that we will need to learn to work in that space. Different resource flows will be at play. Big private sector flows, big time. How do we position to help harness those resources still for the purposes we all believe in and your organization's missions, but it's a different space. And I invite you all because the sooner we all get there, I mean, with public, with private, with international resources.
We were at a dinner the other day talking about the ADIS conference, and I said we need to embrace the term financial engineering in the global development space because, in the end, when you look at the future of development financing, which is what we're going to talk about in ADIS, essentially we know one thing going in. There's not going to be a lot of new overseas development assistance. So it's all about engineering the other sides, the domestic resources, governments, local governments, philanthropists from developing countries who are now stepping up in a bigger way than before, private sector. But essentially, we're moving into a more complex world. And I want to turn to you in this, Carlos, because a lot of what Ariel is saying is that we're in a market that's going through a disruption, in a sense. The old model was pretty easy. It was you have a donor, and you have an implementing partner, you have one relationship, maybe you get 80% of your funding from that agency, and things are a little bit clearer. This new model we're in, you're standing up local organizations that need to generate their own domestic revenue. You're crowdfunding. You're finding philanthropists. You're finding private sector partners. You're in a very different world. And we're actually running a campaign on DevX now called The Future of the International NGO. And we're looking at this, talking to people like yourselves. So when you show up at work every day now versus a decade ago, in your role as the chief operating officer of one of the biggest NGOs in the world, do you see this market dynamic that Ariel's talking about?
Yeah. Save the Children, it's getting ready to celebrate our 100th anniversary, which is great. But how do we stay relevant over the next 100 years? That is a constant anxiety for the entire federation. What's our role? What are we supposed to be doing? So we have so many different business models throughout the federation, even in the US. Two things are for sure. Localizing for us will be key to achieve our mission, to be able to influence the government, to be able to have a voice. So we need to figure out how to expand the membership, which will cost a fortune, and how to find those resources. And the other one is to diversify. With all due respect to our great donor, USAID, our most important donor, we are trying to diversify. It's now around 35%, 40%, looking at Jenny. We're putting a lot of emphasis on private sector, corporate foundations, individual giving. So that is what we think is that's going to allow us to remain independent and to fulfill our mission. So those are two key goals for us at the moment. And yeah, it's overwhelming for large NGOs, and I see there are others here. It's a bit overwhelming finding your space because you have such great intent, such beautiful missions, and there's such a need out there. So where do you fit? When do you really let go and let the local NGO take over? When do you say we need to get out of this middle-income countries? You have no idea how stressful that is for Save the Children to exit a country.
Right. It's like, are you saying everything's done? All the problems are solved?
It's like, really? So, because we really want to focus on marginalized communities. So if you're focusing on marginalized communities, you always have a role in middle-income countries.
Including advanced economies.
Including
like
here in the U.S. So yes, we're very much right in the middle of it, trying to find our space. Very positive. We continue to grow. Not that bigger, it's better. but we continue to be able to attract that funding.
And Raj, if I may jump, you asked me to jump.
Please
right?
jump.
The good thing, in a way, in terms of your own sustainability and so on, is that at least in health, which is a large space, is one that, unlike food, where efficiency eventually meets the demand and then shrinks as proportion of economies. Health and the appetite for well-being, for certainty, for immortality is infinite. And we have not seen any place where that demand is ever satisfied. So that as long as economies continue to grow, you will have a forever increase in that appetite for health, for well-being. And in every case, growth is never perfectly equal. So there will always be inequalities. And because we care to address inequalities, to address the well-being of people, there will always be a space. So the space is changing, but it's not shrinking, and it's not going to end. It's just changing. And I know many of you are already minded that change, but it's a space that is likely to expand. It's just going to be different.
I agree completely. It's a great message. I see a lot of people in the room who know a lot about this and could be easily up on this panel. So I'd like to make sure we have plenty of time to go to you. But Karen, you can jump in first, and in the meantime, think of some questions, and we'll be going to you in a second. Please.
I just wanted to allay your anxieties that international NGOs will always be needed in our countries because we have not yet arrived. We have a long way to go, and we don't have all the capacities. What I said earlier on is that our partners, our donors, we want them to recognize that we have some inherent capacities and that there's things that we can do better because we know the context. And for example, if you asked me, what are your capacity needs, I have them at the tip of my fingers. And I would want our partner, our donors, to think alongside with us, okay? And let me tell you what my capacity needs are. And because you always be my partner, whether you are in Washington or in Lusaka, you always be my partner. But let me tell you what I need in terms of the capacity that I need in order to implement a large-scale program.
Healthier relationship.
Yes,
yeah?
yes.
I'd love to follow up, but I'm going to go to questions. So who's got a question? Just raise your hand. I think we have microphones that will come to you. I see two in the back. We'll take three at once. And there's one over there as well. And please, if you don't mind just saying your name and your organization. And,
Right. So my name is Michael Carroll, and I just retired as the Acting Inspector General for AID. Accountability component, a big risk factor here, in that if we were going to give money to a large donor, we have accountability there. Law enforcement, nexus to that organization, God forbid we have to bring a prosecution or something like that, we could. Now, we can't. Money goes to a local donor, money goes to a host country government, and it's a very tenuous nexus to accountability. And we try to bring this up to Raj several times without a lot of...
the other Raj.
The old Raj, not the new Raj. And you asked a very good question. Congress is going to ask. You know, that's taxpayer money, and it just went, and we have some good relations. Maybe we are, but I think we need to talk about that. Great. So it's more of a statement than a question.
Great point, great point. And we're going to take one behind you, and then another one
While
over
you're getting
here.
that question, many donors brought up exactly that point. And there's a continuum of donors.
Or perhaps a slightly different tangent, which is bringing local global. And when thinking about a lot of, especially because we're going into the SDGs, into this new global health landscape, when we're working on all of these global initiatives.
But there are other methods you can use. I'll mention the Global Fund. The Global Fund has a local funding agency in country. And they are looking at our books every 2 months or so. They're in the field to make sure that the money we send, because we are sub-granting, that it went to where we sent it, and it has been used for the purpose that it has used. In working with the local funding agency closely, and those are accounting it, there must be better ways of accounting for money than spending so much, months on end, weeks on end, just accounting for $10,000. instead of implementing and reaching more people and giving you the numbers that you want.
Types of risk. There's fiduciary risk, which we've talked a lot about and we're very mindful about. There's reputational risk. There's contextual risk. And there's programmatic risk. So what do you mean, and I'm going to come back again, once again, we're looking at it through the lens of sustainability, meaning that not only do you get the results, but that they can sustain on their own. That's the fundamental difference here. So for programmatic risk, we can, as I like to say, seal something so tight that we don't lose a dollar. And then when that mechanism is over and it doesn't sustain, we've just lost millions of dollars. And so we're starting to socialize that conversation a lot more.
So the biggest risk is a failed project, basically.
Well, investment, yes, exactly. Or putting that conversation in there. How can you, what are the acid tests for that? Do ex post. I know, say, the Children's doing it, Plan's doing it ex post. Go back 3 to 5 years and tell us what's sustained. And I've talked to my colleagues in IG and I said, that's something to consider. Let's do some ex post there. Because it's really, at the end of the day, the risk is that it doesn't sustain it, that it doesn't have impact. There's also a conversation that, we do a lot of financial risk assessment. We take that responsibility very, very near and dear to our heart. It does take longer, so where people may think we're already into implementation, we may just have finished that risk assessment. So there is due attention to the risk assessment. But I'm sorry, I lost my train of thought on that one.
Can I jump in?
I can jump with another angle. This is clearly, and Mike, of course, it's great to have a champion. So risk management, I just want to say that if there's paperwork pain on your side, there's a lot of paperwork pain on our side. But we had to follow the law, we had to follow the rules, we had to do it right. And so doing it effectively, as Liz said, is very important. So yeah, just to say yes, but it's sort of inherent to the space in which we operate. I think that we need to learn to do it better.
But to David's point, this is a natural advantage that the bigger organizations are going to have because they're going to have the bandwidth, the capacity, the people.
And maybe it's more organizations need to come together. And also some of the big organizations were small at some point and they have grown, right? And that's been the case in global health the last 20, 30 years. So there's a good time to start a bit. We have to follow the rules. And on the small business, I think that in parallel to efforts to improve on local solutions, there's been an effort to improve on small business at USAID, and it's been quite successful. I think that, years ago, we used to be ranked an F. There's a ranking in the USG because we all believe this is important to engage private sector. I think when we arrived, we were just coming out of a C, and now we are an A+. So there's been an incredible amount of engagement of small businesses, and you should certainly be part of that because the opportunity has been growing. In sometimes it's large conglomerates, sometimes other small opportunities. We are also developing new ways of doing things like the grand challenges, for example, that recently you heard about the Ebola response. We got 1,500 ideas, right? And we have developed mechanisms to deal with many ideas and then to fund them initially and then do an additional scrub before you move to the next stage. So we are trying to explore possibilities. Before I joined the Obama administration, I was the head of global health at the Rockefeller Foundation. It's a different world in terms of the flexibilities. But we understand that this is taxpayer money and it has to be, it's not only about trusting. We must document, we must report.
But let me jump in there. So just to finish my thought there. So, basically, we essentially believe that you've got to use the systems, as somebody would say, run the money through the pipes. Doesn't mean you have to run them all through the pipes, but really to see where those pipes leak. And really, it's not about avoiding risk. It's mitigating risk. It's about managing risk, and that's relevant for both the private sector and the public sector. Second part, actually, U.S. small businesses is part of the local solutions village, as I call it, and they've actually doubled in terms of their domestic acquisitions. And the last piece, and that's in reference to small U.S. NGOs as well as local NGOs, and their colleagues in the room, we're pivoting the development grants program to, I think they're now calling it all in lower capital letters, local works. And it really is focused on working directly with local U.S. and local organizations, and really taking the systems thinking with earmarked, uninitiative funds, and really starting to try to test out some of that things. So stay tuned for the local works. It'll be limited to 3 to 5 missions, so we can dig deep and longitudinally over time to really test some of this directly local, as Karen would say, thinking.
I just wanted to add that everybody that we interviewed really felt that there was no issue with measures to ensure accountability and value for money. They understood it. They got it, particularly with global recession and development budgets being shrunk. They get that. I think what they were calling for was, let's try and make this easier. Let's streamline it. Let's think of ways to make all of the compliance regulations easier. And so that could be local fiscal agents like Karen talks about, or investing in systems where it's not so hard then to account for every single dollar that runs through the programs. There actually are easier ways of doing these things. You just need to have the tools, the systems, and all of the staff to be able to run them. So that's really what came out of the report. Accountability is not an issue with recipients, and certainly is understood.
Yeah, but I get it that it's understood, but it's also, just looking at you, Carlos, because when Michael's talking about law enforcement, what he means is the ability to arrest U.S. citizens, right? Or people in countries where we have agreements, right? And so the stakes are high for organizations that take on this taxpayer money. And it's not a small matter to dot all your I's and cross all your T's. I wonder if you and maybe Karen have thoughts on Christine's question here. You know, she mentioned the global financing facility. We're in the year of the Sustainable Development Goals. You know, there are so many global conversations going on. Is she right? Our voices from the South really?
We are making sure that we get their voice, because 4 years from now, 10 years from now, we don't want the U.S., the UK, Sweden at the UN Global Assembly. We want Save the Children in South Africa, Save the Children in the Philippines, to be representing the voice for children. So I think there's a lot more work to be done. I think when you go to those meetings, you see even from federations, you see the northern members are the ones represented. So how do we change that? I think it will take time.
And Karen, thinking about your own group and even the many much smaller NGOs in your country, do you see their voices represented? You know, are you talking about things like the GFF or the Sustainable Development Goals? Is that part of the conversation where you are?
Yes, I think most of the global funding mechanism are increasingly involving the voices of the civil society. They're increasingly making sure that on those boards where you have the civil society representatives and people who are coming from the communities. But in terms of other bilateral arrangement, it's usually government to government, and the agreements are made there, and we all have to buy into the government strategies. And that's okay as well, because we all have to work, whether you're international NGO or local NGO, you need to work within the government strategies. And the government is government to government agreement in terms of the strategy and the support which the particular government will bring to our country. But I must say also that as we look forward into the future, talking about the Sustainable Development Goals, and I think we haven't done very well in some of the Millennium Development Goals because the civil society voices were left behind. The local communities didn't have much input. The strategies were being developed somewhere in the year 2000 or 2001, and at that time, the local voices and the civil societies were not included. Now, as we look into the Sustainable Development Goals, we must also remember that unless we sustain the capacities that have already been built, so in working with local, we have to make sure that those capacities that have already been built are sustained. Okay, and that also funding is made available. We can conceptualize a lot of strategies, nice sex words. None of that is going to happen. We're not going to even achieve the sustainable goals, sustainable development goals, unless those capacities are sustained. So in the international organization working with us, making sure that those capacities are sustained. We are also aware that you poach people from our organizations. But for me, that is the least of my worry, because this is a human resource issue. I can't stop somebody moving. Fortunately for CHAS, we haven't had a high turnover of staff because we just make sure that, not because of salaries, that there are other conditions that staff enjoy. I mean, staff can come and say, today my daughter is very sick, may I go to hospital? It's not a big deal. They'll go so long as, you know, they can produce, the goals that they have set for themselves and the organization, they've been achieved. It's not, so the other conditions, not necessarily the money. We know also that local, international organizations in our countries pay more money, so there'll be migration from local employers to international local. But I think that's a human, like I said, it's a human rights issue. If I want to move, nobody should have to stop me. So you can't stop. But it's, I think, leveling the playing field of employment conditions. And as a local organization, it's very difficult to attract very competent staff because you are competing against international NGOs and donor agencies that are paying much more. Mm-hmm. One of my staff left and simply said, I would like to be here. I feel very much at home to be here. And this organization really has built my capacity, and now I've even got a USAID job. And 2 of them left in country. And I said, tell me why you're leaving. And they said, you know, madam, it's nothing. It's just that I'll get more money. That's all. Simple as that. But you can't stop because they have, at a personal level, they must send their children to good school and we're not paying much and you can't stop people moving. So for me, that is the least of my worry. But we need to be on the table. When USAID is strategizing and the country program to Zambia, we need, as civil society, as local organization, we need to be on this table. Because we also need to learn how you strategize and come up with a fantastic framework. and then if you include me on the table, that capacity will be sustained.
But it started with 4 countries in Tanzania, Kenya, DRC, and Ethiopia. We certainly want countries to commit to the space of health. And in the business planning process, there's been representatives of civil society and representatives from Tanzania and Ethiopia, with many other organizations, of course. And locally also, we have had several consultations, and the Partnership for Maternal and Child Health has been conducting surveys and so on and so forth. But as someone who has been involved in the thinking of this from the beginning, I also welcome any additional views or ways to engage even further. So we're very much open. And we certainly, and results who have been in the oversight group for this, has been a clear voice that at the country level, we also need to have not only just the Minister of Health, Minister of Finance, but also civil society, because in the end, Ministers of Finance will not commit resources unless they sense that that's what society really needs or believes. And even with that, it's not easy, but clearly we will need the voices on the ground to make the case politically for governments to commit loans. It goes into their bottom line to the social sector.
Because this does, in fact, animate our thinking in the international NGO space. One comment and one question or suggestion. I actually think local and localization has a negative connotation. And so for example, national organizations, I think local can tend to be a little pejorative sometimes, so I suggest national is perhaps another thing we ought to look at. But when you talk about the need to use the apex institutions as part of a system, let me say there's an international NGO or a network, a global network, that can help sustain that bridge funding requirement, hundreds of people will be let off. And so we need to shift from a project mindset, I submit, to an institution mindset.
IHP is definitely on the table in a lot of our countries now. Yeah.
And I think that connects somewhat to Carl's point here, which is if you were to do an audit like that, perhaps one of the things you might look at is the balance sheet. You know, are the assets of that institution, their ability.
Ownership of priorities, with the countries setting the priorities, country ownership of implementation, that's a lot of what we've talked about here, and country ownership of resourcing. And he's alluded a bit to that, to the domestic one in the PFM. I don't know who you are, but we will talk on the standards part. It's an interesting conversation. I'd like to follow up on that further.
Well, you can't call it an audit. Don't call it an audit, because if you're not going to audit standards, which GAO holds the IG accountable to, which is
right. Make sure that we account for this money. But let's make it simpler so that we can account to the taxpayers. because sometimes it's so agonizing with the accounting procedures and the reporting procedures that at one point you are like, you want to throw in a towel. But because of the people that you're saving people in the rural areas hard to reach. And
Because there will always be the need that we all address in health, in well-being, and in equity. Thank you.
I sat on a panel a couple of weeks ago with the Ghanaian finance minister, and everything he was saying was very negative and